Mahafide, and welcome to another episode of CNMI Weekly. We're back at the Community Guidance Center talking about Suicide Prevention Month. And so I want to have these folks joining us, Shireen and Anna. Introduce yourselves, your role, and how long you've been working here at the office.
Good morning, everyone. My name is Anna Ada. I am the program manager for the Suicide Prevention Program under the Community Guidance Center, CHC. I've been working with the program for the last 7 years. It started first with the Gary Lee Smith grant. It expired 5 years. It was met for 5 years. And then we transitioned into the Zero Suicide Community Grant, granted by SAMHSA, Substance Abuse Mental Health Services Administration. We are on our 4th year with the Zero Suicide Grant, and we're actually hoping for a zero suicide community. So we do a lot of prevention through trainings and outreach and intervention, which is the counseling and therapy sessions that our mental health counselor provides.
All right, thank you. Thanks for joining us. And Shireen?
I'm Sharina Clark. I'm a mental health counselor with the Suicide Prevention Program, and I've been with the program for a little over 6 years.
All right, and so it is Suicide Prevention Month, but I wanted to first talk about what it looks like for our community. It was in the paper recently. We've had over 60 deaths by suicide in the last 10 years. What can you tell us? Because it's more than, the numbers. These are, our community members or family members. So, what is the, how big of an issue is it here for the CNMI, I guess is what I'm asking.
I'll hand that to our mental health counselor.
Well, considering our population, over 60 deaths is a lot. 60 deaths are a lot, right? For the program itself, we've provided services to individuals as young as 7 and as old as 78. We've provided direct intervention and therapy services therapeutic services to over 700 individuals since we opened in 2018. So it goes to show that our services are required here, are necessary, and that suicidal ideation and even attempts are a big issue, and they need more attention. Like the mental health services need more attention.
A lot, at least for the CNMI, is relationship challenges, financial, and some may have a diagnosis, mental health diagnosis. And for the older folks, I've observed that chronic pain is also a contribution to suicide death.
And as a counselor yourself, what do you think people, what do we need to know more about? How can the community educate ourselves, or what's the misconception maybe about suicide or about mental health?
I think there's a lot of stigmatization in the CNMI. It's worldwide, but here I've seen it. A lot of people are afraid to seek services because of the things people will say about them and to them. Mental health is just as important as our physical health, right? And I think that's something that's misunderstood here, is that without proper brain function, how are we allowed to function at all, right? So I think that that's something that really needs to be, discussed more, right? Checking in on our friends to make sure that everyone's okay, to take note of things that we recognize in the people that we love and care about. If we notice that someone's become withdrawn, they're giving their things away, they start joking more about wanting to die, those are like indicators that someone may be suicidal, and it doesn't hurt to ask, right, if someone is having thoughts. And then seeking help. Our program is free, our services are free. We do home visits. Like, there are no barriers to seeking help, really, because we take the steps necessary to help the people who need the help.
And do we have enough counselors? What's the outlook on that? How many counselors do we have, and how many would you like?
Okay, so we have one. I'm the only mental health counselor,
Okay.
but we do have two behavioral health specialists that assist with assessments and brief interventions.
And then we also work closely with a psychologist, Dr. Glenda George, and the psychiatrist at CHC. Usually people who really have done some attempts, harm to themselves, they're actually housed safely at CHC, and then the psychiatrist would communicate with us for outside outpatient services. But there's dual services provided to people who've attempted.
So, just to clarify, are you the only mental health counselor on island, or the only one at CGC?
The only one under suicide prevention program.
Oh, okay, all right. So I guess what is the need? How many would be an ideal number? I mean, because you guys, I can imagine your caseload. I mean, what is your caseload? How many people do you see on a monthly or weekly basis, would you say?
I currently have around 34 active clients, and these are individuals that fall into the high-risk category. So they are individuals who have either made an attempt or have overwhelming suicidal ideation. Those are the ones that I see. I think our numbers right now as a program are in the 50s. That means that the other two staff, the behavioral health specialists, see the ones who are at low to moderate risk. Ideally, I'd say that it would be nice to have 2 more mental health counselors, but that's a reach. We do have days and weeks where things are slow, but then when they pick up, sometimes they pick up really, like last week we had 6 referrals just on a Friday. And especially with school having started up again, we get a lot of referrals from PSS to conduct assessments.
Why do you say it's a reach? Is it funding?
Perhaps, but then also there's a lack of qualified individuals here who can become mental health counselors, right? Because we have to have our master's degrees and things like that. So we really try to enforce, especially with our interns, right, to like get into the behavioral health field because there is a need. And we like to hire locally so that people that come to seek our services or receive our services, we can relate to them on a level, because I think that's important too, being able to relate to the people that we see because we're from the same place.
Did you want to add anything?
Well, mental health counselor on a master's level is actually, there's a shortage nationwide. It's not just CNMI. We can't just hire, a lower level educated person, even though they may have the skills. But, to pass CMS, Center for Medical Services criteria, it does require a master's level in psychology or sociology.
All right, and I do want to ask you, Anna, about the Zero Suicide grant and the campaign. Can you tell us more about that? Because that's a big goal, right?
Yes. So what Samshare did was provided grants, funding to work with the healthcare system, and we're going to be the outpatient or the outpatient service while they're the inpatient. So medical doctors will only check, physical or things like that, right? But we're trying to, and it's actually working, provide them the trainings. So when a patient comes in for their appointments, right, they have the ability to at least notice and observe through conversations if this person may be depressed or may be needing mental health services. So that's a goal. It's working. We've had conversations with emergency doctor and medical providers. The psychiatry already knows. Our partnership is really strong. So that's our backup. That's also our go-to division when it comes to suicide cases.
And so I want to talk about resources. You guys already alluded to a few of them about intervention. But if someone's watching this interview and they need help, where can they start? Where can someone start?
They can
Or
call
if
us.
if they have a
Yeah.
family member who notices, you know.
They can call us. It's really an open referral, and we have some families that have called our office asking information or referring their child or friend, and of course we don't take it lightly once we hear it. Sharina and the behavioral specialist starts the process by reaching out. We've reached out to people who don't want services, but we don't really give up. We try our best, and we do call them back if they are discharged. We do have this procedure that it's called aftercare. We call them like within 30 days, 60 to 90 days, and ask them if they're okay, if they're wanting more services, because we actually, it's a short-term type of service, but Sharina would sometimes continue on more than the three required intervention. It's really it depends on the case. So I always, yield to her. I don't decide on the clinical. She does, as well with the supervision of Dr. George.
Right. And yeah, what would you tell people?
So they could call the office, right? Our number is 664-5483. Or also, we can be connected through 988. So if they are in distress or having a mental health crisis, they can call 988. And if there is suicidality, 988 will inform us. And then we can reach out to the individual to offer the services we provide.
And I know there's been a huge campaign for 988,
Mm-hmm.
right? But when someone calls, does that get routed to a local office here first?
So
or?
between 7:30 and 4:30, it's
Okay.
handled by the local staff.
Yeah.
After 4:30, it's routed somewhere else. I believe
Okay.
Guam.
Mm-hmm.
Yeah.
All right. Anything else you think the community should know amid Suicide Prevention Month?
I would like to see a zero suicide community. I did lose a brother 15 years ago, and that is something, if I was aware of all the signs, maybe I would have done something, but I didn't until I started working. But I don't want people to lose hope. There's always hope, have some faith that things will get better, even though it doesn't seem to be, at the moment. But as long as you talk to someone you trust, I think you'll be okay. But please, reaching out is not a problem. We practice confidentiality. We have to. I'm encouraging everyone to call us. Our number is really easy. It's actually 664-LIVE. We chose that number because it's got meaning too, right?
Yeah. Okay, thank you. Sharina?
I think that seeking services, mental health services, especially when it comes to having suicidal ideation, it's not a sign of weakness. A lot of people are afraid because they think that struggling makes them weak, and that's really not the case, right? Getting help means that you're strong, and putting yourself first and making sure that you're okay is super important. We can't take care of anyone unless we take care of ourselves first, right? And it's really important that we recognize that. There's no shame, there's no harm, there's no embarrassment in seeking services. We're here to help people, and we want to help people. We're really passionate about our jobs, and hope people take note of that.
Yeah.
So we also, if it's a very private thing, right, going through a suicide, but we are very flexible. If you want privacy, Ms. Sharina or the BH specialist can go to you. And sometimes we do that. She does that a lot. Goes to home visits or somewhere private, if a person wishes a private session.
All right, thank you both. Thank you and your entire team for what you do. It means a lot. And I know that this message is beyond this month, right?
Yes.
This is an everyday message. So thank you both for your time. And thank you for joining us. We'll have more right after this.
I'm therefore gravely concerned to see that there are several key provisions of the COFA Amendments Act that have not been implemented in a timely manner consistent with the clearly expressed intent of Congress and agreements signed by the President.
The Subcommittee on Indian and Insular Affairs held an oversight hearing this week on the implementation of the COFA amendments. Access to health care for veterans was a key issue that dominated the hearing, which featured executive department representatives and island ambassadors.
We have yet to see the Department of Veterans Affairs carry out any of the services in the FAS that it was charged with under COFA. I find this unacceptable, but somewhat not surprising under this VA administration that seems to have forgotten that their job is to serve all of our veterans.
The VA's representative responded to concerns.
VA is exploring a comprehensive care model for how FAS veterans can access hospital care and medical services to align generally with how VA provides care to veterans living in the U.S. Implementation may look different depending on agreements with the FAS governments, current infrastructure, and the varying degree of reliance on the ways veterans can access care.
However, some lawmakers say those actions need to be taken immediately amid the VA's red tape.
We don't have all that much more time because these benefits are due and veterans need this help. They're in a very difficult situation. So we're going to stay in touch with you on this, but I would urge alacrity.
Ambassadors from Micronesia stressed the urgency, especially since traveling to Guam or Hawaii for healthcare is costly.
We have tried to reach out to VA. We haven't received anything.
Timing is an issue here. We're given 1 year to complete the negotiations to work through all of this. So I hope we can keep that in mind.
We have veterans in the islands that they need the help. And the sooner we get there, the better it is for our veterans, for receiving the care that they earned and they deserve.
Should we keep the doors of the courts open on Saipan, Tinian, and Rhoda, or should we shut it down? Mr. Chairman and members of the committee, the answer to that question now is in your hands.
That was the judiciary in a July budget hearing. Overnight, CNMI Chief Justice Alexandro Castro and Presiding Judge Roberto Naraha expressed concern from the court about the proposed fiscal year 2025 budget. The concern centers on a particular section of the House Budget Appropriations Bill, which prohibits the use of funds for costs related to judges and justices who are appointed temporarily to hear a case. Those judges and justices are often appointed from Guam when a CNMI judge or justice is not available or has conflicts of interest. They noted that even with a Senate amendment allowing expenditures for cases done virtually, the restriction creates a major barrier to justice. The judiciary wrote in its letter to the legislature that the section effectively prevents the judiciary from exercising this constitutional authority. Without the ability to pay or cover expenses for these judges, the courts will be unable to address case backlogs or handle matters in which regular judges are disqualified. This will severely impede the administration of justice and deny timely resolution of cases to the people of the Commonwealth. The court went on to say that the prohibition violates the constitutional mandate that empowers the Chief Justice to appoint judges and justices temporarily. They're asking the legislature to reconsider. House Speaker Edmund Villagomez told KUAM that the House is waiting for Senate action on the budget bill. Meanwhile, the Senate President Edith De Leon Guerrero told KUAM that a floor amendment will be offered to remove the section in question. Some legislators have expressed frustration over the frequency of recusal of local judges in cases involving former government officials.
The establishment of this will focus on deterrence, interdiction.
The NMI Department of Corrections is expanding its efforts to stomp out drugs from the island's prison. KUAM News went behind the scenes at DOC with officers part of its new K-9 unit. In this training exercise, the K-9 found hidden drugs in the visiting area that were placed there for the simulation. DOC will continue to work with law enforcement agencies amid its renewed focus on establishing the unit in recent weeks.
It's essentially going to cover anybody coming in here, going through the visitation that could, that would probably have to go through that through our K-9, right? Or when we're doing shakedowns in the units, vehicles that are parked over here around the facility, and now with the parole coming under DOC, we would have that extra tool where we can assist our parole officers in their operations when they're conducting home visits or random work visits as well. So we're excited.
Giovanni Taitingfong and John Pangilinan are the first officers assigned to the unit.
My dog is a dual purpose, meaning it could detect drugs and apprehend if need be. So, I constantly patrol the area in and out. It's a good deterrent, good tool. God forbid if anybody was to be hostile in there, my dog will be apprehending the individual. We're going to be constantly, being proactive and fighting the war on drugs here.
Our neighbor to the south, Guam, has had cases, even death related to fentanyl, and then so we heighten our ability to educate everybody. Our first goal was to bring all the frontline people together.
The NMI's frontliners armed with education and naloxone used to reverse an opioid overdose. While there are no reported deaths linked to fentanyl in the Northern Marianas, healthcare and law enforcement officials are wasting no time in preparing for its impact when the drug reaches the island shores.
There's two things that concerns us very much. Yes, I've been doing this a long time, and I've seen bad drugs, but I've not seen a drug that's bad and deadly at the same time. That immediate attention needs to happen, or the person will die. So that's one concern. The other concern is that these drugs, unfortunately, are not usually drugs that somebody can go down the street and buy from a dealer. They can be ordered. They can be ordered through the dark web. They can be ordered, and most of the cases in the states of young kids, they order it through social media.
He said more of the life-saving medication is on its way to the NMI, so they're preparing the front line to use it if they have to.
So that anybody that wants it should have access to it. And what I mean by that is that family members would know if their loved one is using drugs or not drugs. So if they're using their loved one is using drugs, arm yourself with Narcan, because you never know if they're going to get in touch with an opioid.
Thomas Manglona, KUAM News, Saipan.